Hi, and welcome to this webinar on cardiorespiratory cases in small mammal medicine. Delighted to be presenting this with Aidan Raftery, a colleague from Manchester, and we have fortunately been able to collaborate on many cases over the years, and hopefully provide our different perspectives on many of these. Our aim during this webinar is to present various small mammal cardiorespiratory cases, hopefully quite varied in species and in type. And what we're trying to do is less create a puzzle to solve each time, but more illustrate how we came to different diagnoses, how we use different diagnostic techniques, or some of the unusual or different underlying causes in small mammals, and also some of the therapeutic options that are out there which we can use. It's not just giving a set of antibiotics often. So in summary, basically what is actually possible to be done for these cases rather than, as I said, just dispense some antibiotic. So let's start with case one, which is a 6-year-old female neuter rabbit. She was presented in respiratory distress, extreme distress, and bear in mind rabbits, because they can't breathe through a mouth very easily. If they do start mouth breathing, that shows absolutely severe problems. This was the sort of state she was in. So we did a basic examination. I think it's really important to emphasize for these cases where they are in extreme distress, a detailed examination is often not possible, and something does need to be done either in terms of sedation, which doesn't compromise respiratory system, or just a minimal examination just to reduce the problems and reduce things getting worse during that time. That's quite important. I went to stabilization. So she received oxygen. We gave a very short-acting corticosteroid in her case because the signs were so severe, antibiosis and some fluids. We did not immediately start feeding because, again, if they're in really great distress, it is very difficult to feed safely without inhalation. Next day, we performed radiography. She was fit to be sedated for this. And we got this sort of picture. We've got leafing of the lungs. We've got a clear, obvious amount of fluid present. So what do we do in these cases? This is one thing we can do exactly what we would do with say, a cat or a dog, and that's we can prepare the thoracic cavity, and we can perform thoracentesis, and we were able to withdraw some fluid. This can be analysed in exactly the same way as you would for a dog or a cat. So we can look at turbidity, we can look at the basic colour of it. We can see it's quite cloudy there, so something's happening inside there. And that means it's a good one to do some cytology on. And these are the type of cells we're getting. And as you can see, there's some really ruptured red blood cells are quite sparse, and the cells that are coming out are really quite unusual looking. And that makes you worry. So we drained off a quantity of fluid, I don't remember quite how much, but a reasonable quantity, and re-x-rayed. And we can see that we've got expansion of lungs, we've got a bit more air in there. She was breathing better even under anesthesia at that point too, but we do have some consolidation, especially obscuring the heart shadow. So next test this stage was to perform an ultrasound, and this did reveal a mass, and given the bizarre cells and her signalment, we really felt this was most likely to represent a tumour. And at this point, we only elected for euthanasia. The actual tumour was not diagnosed, but was probably felt it was going to be a primary tumour in that region. So what lessons do we get from this? Well, first of all, probably the timing of the use of a corticosteroid. Small mammals are pretty sensitive to the effects of corticosteroid, so we very, very rarely use them. In this instance, we felt that with this respiratory distress and with inflammatory disease being so common in rabbits, that this was a time we could use one, but kept it ultra short acting, so that we were able to switch therapy if we needed to afterwards. Using it for a tumour might be deemed to be a good thing, but whether that tumour would have responded to longer term corticosteroid is unlikely, and we're not sure. The other thing too, this is a case from a few years ago, before things like TFAST were really well known. And I think probably one of the options we'd have these days is to do the ultrasound before the radiography. And doing that would identify the fluid a lot earlier, and might have enabled drainage using local anaesthesia before we moved on to radiography under sedation. So things change as they go along too. And I think ultrasound for chest cases is really quite a good modality to be considering using in many of these cases. One thing I will draw up before moving on from this section is that this is actually the case that I illustrated was a female neuter. This is a female entire rabbit, also presented in respiratory distress. And these, as you can see, we've got some interesting cannibal metastases here. And I think when you're dealing with an older female entire rabbit, do always bear in mind that uterine adenocarcinoma is very common as a cause of many different problems and will metastasize all over the body, particularly the lungs. And I think that's something should be borne in mind. So these older rabbits. So thank you for listening to that. And I'll hand you over to Aidan for the next case.
Right. So we're on to a different species, moving away from rabbits. This is a degu. I'm not sure how commonly they're seen in practice, but we see lots of them. Just a few facts very quickly about them. The life expectancy 6 to 7, but we often see much older ones. They are hindgut fermenters, so they shouldn't be fed the same diet as gerbils or hamsters. They're coprophagic, just like rabbits and guinea pigs, chinchillas. They are social. They need to live in social groups.
Sticks.
So one important thing about handling them is don't pick them up by the tail because they tend to twirl around, and degloving of the tail is very common. Scoop them up in a towel. They are much more difficult to restrain and examine than guinea pigs or chinchillas. So it's good to have an experienced assistant to help you. So onto the case. Jinx, a 5-year-old neutered male. Lives in a large, sort of very nice aviary type of enclosure with large branches for climbing and with a group of 5. Is fed degu pellets ad lib with hay and water always available also. Substrate is sort of wood shavings and sand, and never treated for parasites, but we don't really see parasites as a problem with them. Jinx had a history of chronic dental disease when he came to us. And there was a vague history of having had a few dentals, but there wasn't any detail of what was actually done at each time. 2 others of the same group also have ongoing dental disease. And currently, Jinx was on enrofloxacin and meloxicam. So meloxicam at 0.3 milligrams per kilo once every 48 hours. So he was referred because of respiratory signs, which started about 9 weeks earlier and were slowly progressive with no response to the medication. These were exacerbated by exercise. There was no nasal discharge, but there were bouts of sneezing. So on clinical exam, listening to the chest, there were referred respiratory sounds from the upper airways. On palpation, the ventral cortex of the mandible had areas of remodeling. That was the sort of thing that's pretty common with chronic dental disease in these guys. Intraoral exam, the incisors, the crowns of the incisor crowns were elongated, and the cheek teeth, we had sort of fairly severe signs of a chronic dental disease. Here is a radiograph. It's actually not the same degu, but you can see severe dental disease in this case. You can see where there's elongation of the apical areas of the cheek teeth. This would be causing remodeling. You'll feel this as bumps on the ventral cortex of the mandible. Just an interesting point about rodents. The apex of the mandibular incisor is all the way back here. That's why we don't remove. It's not possible to remove these. Here, there is a bony structure here in this degu, and that is an allodontoma. Quite commonly, in the case we're talking about, the apical areas of the maxillary incisors, maxillary cheek teeth, elongate and cause problems in the nasal cavities and obstruct the breathing. In this particular case, it was the allodontoma. So how do we treat this? We try and manage to maintain clearer airways. And the airways are partially blocked, partially by inflammation of the soft tissues there caused by these structures growing. So if we can use anti-inflammatories to reduce the inflammation of the lining of the nasal cavities, that will have an impact. If we can also use something to try to clear away excess secretions, that will also open up the airways a bit more and help with breathing. And we do that by nebulizing. Hypertonic saline is very effective at cleaning the nasal cavities. We try to manage the dental disease by correct diet. Pellets are not the correct diet. Then, just like sort of rabbits and guinea pigs, they need to be using their teeth to grind up the food, otherwise they overgrow. Non-steroidals, meloxicam is the one that we tend to use. We don't have any data on dose or frequency of dose in degus, but in guinea pigs, which are the closest animal that we have data on, we need to use 1 milligram per kilo at least, and every 12 hours. Analgesics, gabapentin, some of these guys are in discomfort, and analgesics would help, and gabapentin would be the drug that we would use. The elodontoma management, medical as above, are surgical. There are surgical treatments reported. You've got a procedure called stent rhinoscopy, where you basically make an opening into the nasal cavity just posterior to the elodontoma. These are usually, in most cases, around the incisors. Extraction of the teeth and removal of the elodontoma is also described, but these surgeries are more commonly described in prairie dogs, which are slightly bigger animals and would be much easier to do the surgery. So back to John for the next case.
So second case is back to rabbit, another female neuter rabbit, 5 years old. It's very quiet, and was showing weight loss in spite of eating, although eating was slightly reduced. We did basic initial workup, including taking history, examination, and nothing too remarkable on those. Now, normally we'll radiograph these as part of my main workup for rabbits with weight loss, and this is what we found on the thoracic view. And you can see here that the heart is appearing very rounded, and is elevating the trachea, so it's actually parallel with the spine. And that's a pretty good clue that there's something going on in that region. It certainly looked a bit large from that view. Now, we can do vertebral heart scores and measure in the same way as for dogs and cats. It's the same rabbit with slightly cleared image, and we can take those measurements. Now, the trouble with this rabbit, and with many of them, is actually it's very hard finding the right place on the thoracic vertebrae to actually measure from. And if you have a look on this rabbit, you can see there's quite a deviation there. And these chronic subluxations around the thoracic and sometimes lumbar spine are quite common, probably following handling issues when very, very young indeed. But it does mean it's very, very hard to measure and actually get that vertebral heart score properly. If you look on this rabbit, which doesn't have that sort of luxation, different rabbit, again, you can see we can actually add those up together and we can get results. And there's some papers out showing that this can be useful. Others show this can be breed dependent. However, in this case, I think we had enough evidence the heart was rounded, the trachea was elevated, and we were looking very much at looking at cardiomegaly. And heart disease, in my experience, is quite a common cause of just not gaining weight or failing to thrive. Part of it, I think, is because of that large heart pressing on the esophagus and difficult getting food past there, and possibly part just due to general efficiency of metabolism. We did further diagnostics. Ultrasonography did confirm we actually had a dilated cardiomyopathy going on, and we then we took some bloods too, and other than showing elevated urea with pre-renal disease, we didn't see too much on the bloods. So we started with rest, and again, I think this is one of those issue we should do with heart disease in many species is just rest them, give a heart a chance to get a bit of a break. So restricted environment for a short period while all medication got going.